Are you a senior with some issues with balance and mobility and maybe have had a few falls? Or perhaps you're a family member of such a person. There's a lot of fall prevention programs out there. However, most of them are geared toward people at the lower end of the fall risk spectrum. And as such, they're held at senior centers or YMCA, someplace where you have to physically go out into the community, encountering increased fall risk. Now, most people have their falls at home. So for a lot of people, it doesn't make sense to, or it's just not reasonable to go out to a facility, which is why I've developed a program specifically for those people that can be done entirely at home. If that's something that interests you, I invite you to keep watching to learn more. My name is Vince Prospero. I've been a physical therapist for over 30 years, 16 of which have been spent working in various nursing homes as both a physical therapist and rehab director. Two main things I've learned in my time in nursing homes is number one, nobody wants to get stuck in a nursing home. And number two, a great way to get stuck in a nursing home is by falling. I'm a certified fall prevention specialist, and I've dedicated this part of my career strictly to fall prevention. I currently treat people in an outpatient setting and have been doing so for about a year, and it's been going very well. My problem is the people that really need fall prevention services typically are not community emulators, and they generally don't go out of the house without someone else's assistance, and yet they're still falling in their home. So I developed a program that can be done entirely at home. The problem with our current system, so to speak, is take the example of somebody falls and breaks a hip, they go to the hospital, have surgery, and then come to the subacute rehab portion of a nursing home. Now, the average subacute stay nationwide is 3 weeks. And the reason for that is that most insurance companies will pay in full for 20 days. On day 21, patients start to accrue a copay, which is typically $100 to $120 a day. Most people don't want that financial burden on top of the injury and the disruption of their life already. And in general, most people want to be home as soon as possible. And most insurance companies want people out as quickly as possible, particularly HMOs. It's a little different depending on the insurance, but in general, the idea is to get them just good enough to manage in the house. So therapy ends up focusing just on the injury, improving weight-bearing ability and things like that. We never really get into the balance and mobility issues that cause the fall, or usually a series of falls in the first place. And then they go home and they'll have physical and occupational therapy 2, maybe 3 times a week for 3 or 4 weeks, maybe a little longer. But again, they never get to focus any actual real treatment on balance and mobility. So 6, 8 months later, maybe a year, after usually another series of falls, they injure something else and they're back in. And eventually, after a couple rounds of that, it's not as safe to discharge them home, and they end up getting stuck in a nursing home. People might believe that they're too old, or their medical status is too complex to really successfully participate in any fall prevention program. I can assure you that's not the case. I've worked with hundreds and hundreds of older people, most of which have multiple medical issues. If you live long enough, it just kind of comes with the territory. So if that's something that interests you, I invite you to click the link in the video to learn more. Thanks.